All right. I think we are live. Looks like it from my tally here. Hello, everyone. I'm Dr. VanderWel at Aviva, and this is the Weight Loss Treatments virtual seminar. We're going to talk about all things weight loss. And yeah, getting some questions. We got some pre-prepared questions already from Erica, Romelia. Thank you for guys for submitting questions. And feel free to submit questions in the chat as well, and we will get to those. Or you'll see a text message thing in there too. All right, so starting with who are we? Aviva. So been leaders and innovators in the field of bariatric surgery since 2004. First practice in the Pacific Northwest to do a laparoscopic sleeve. We're first in the world to do an outpatient laparoscopic sleeve, first in the world to do an outpatient gastric bypass, contributed to a number of studies, and first in the Pacific Northwest now to do an endoscopic sleeve gastroplasty, the ESG, which has been great, and we're going to talk about that later too. We have a bunch of people on our team. We have 3 bariatric surgeons, a bariatrician, nurse practitioner, 2 RDs, 2 PAs, great team. Love working with these people. Love getting together with them. You'll love them too. They really care about patients. They really care about treating obesity. They're really good at it. And yeah, it's great. I'm so blessed to work with such a great team. So let's start with the big picture here. Why is obesity so hard? 30,000 foot view. Our bodies are made to survive hardship and scarcity, not comfort and abundance that we enjoy in the 21st century. Think about even just 100 years ago, 150 years ago. Living conditions, very difficult. You know, even just the climate control in your house wasn't very good. You know, you're cold, you're hot. You know, it's cramped, it's stuffy. The work that we do was so much more physical and demanding in the past. Transportation was much more uncomfortable, much more laborious, a lot more. You can imagine riding in that thing for a Sunday morning versus riding in our current cars. Just the difference in levels of calories you're expending at every single level of your day now is so different than 100 years ago. The types of foods that we eat, the way we make our food, the way we store our food. Like every single one of these things is so much easier now. And all of these things really are working against us when it comes to managing our weight, because our bodies really are in uncharted territory from a weight management standpoint. They really do not believe that obesity is a thing that you really struggle with in life. What you really struggle with is like famine and cold and starvation and extreme weathers and not having enough food. So our bodies are always like, life is really hard. We got to store as much stuff as we can. Obesity is a complex disease. I break it into kind of 6 big topics. Let's go this way. So on this hand, we have mindset, diet, exercise, psychology, support, biology. And if you struggle with this one, no matter how hard you seem to be working on this hand, you are fighting this uphill battle against your body. Surgery is a tool to help us with this. Medicines are a tool to help us with this. Changes that uphill battle that we're fighting into a downhill battle. So you're working with your body as opposed to against your body. Still got to make progress. We still got to do better. We still got to keep improving. Still got to have a plan and structure. We got to know how to use this tool. It's not a magic wand. It's not a cure. It's not a poof. All of a sudden all the problems are fixed. But it's a really good tool. I had a patient describe it to me the other day as like, this is the difference between using a shovel and using a backhoe for this problem. So it's just a totally different game. The big picture that we've always had, in the world, in medicine, in general, is just work harder, eat less, exercise more, put in the work. Remember that show, The Biggest Loser? Most of those people went on to gain their weight back, and most of those people went on to get surgery. I've actually done surgery on Biggest Loser contestants. The problem with eating less and exercise more, it's not wrong. I mean, that is kind of the only way that you can lose calories, that you're burning more calories than you're consuming. The problem is that the way your body accounts for that, the way your body compensates when you eat less calories, makes it extremely difficult to be successful long-term. And only less than 5% of people who really struggle with their weight, have morbid obesity or more, can keep off a meaningful amount of weight, many years, 5+ years down the road. Less than 5%. Like the small side of the single digits. So what are our treatment options for approaching obesity and when we're really struggling with our weight? So we talked about the diet, lifestyle modification, diet and exercise. This is not a bad thing to still do. This is still a part of this story. It's still a part of the program. The problem is that on its own, it doesn't get us to where we need to be in the 21st century. If all of a sudden we went back 200 years in time, we would be talking about a very different story. But none of us are chopping wood and carrying our own water, like amongst many other things. It's just a different story. It's a totally different story in life. And the problem with this is that, the risk is minimal and it's important to work on these things, but it's just full of frustration and disappointment. I'm sure a lot of you listening out there have lived this and have really struggled with this. So the next group of treatments we're going to talk about is medication. I'm going to split up medications into oral medications, like older weight loss medications, essentially, and the newer, like injectable GLP-1 based medications like the Ozempics and Wegovy's and Mounjaros, Zepbounds of the world. So the first one, the oral medications, these are good for usually about 5 to 10% total body weight loss, we believe. And the durability is okay. It can be kind of hard to maintain that weight loss after you stop the medications. And the medications can have side effects. So you got to make sure that you work with whoever's helping you with those to kind of dial those in to make sure that, you're not having side effects, or if you're having any side effects, we can, really minimize them. But generally those side effects will stop, if you stop the medication, and the weight loss is slow, but it's okay. And it can kind of help some of the other parts of this journey. So, but yeah, this in itself is, this is not from a public health standpoint, right? We have so many people out there that struggle with obesity. This isn't the end all cure all for everybody. The GLP-1s, this is a newer drug, really launched onto the scene in the last few years, are working really well. This is some of our best weight loss drugs we've had. And weight loss is usually somewhere between 10 to 15% total body weight loss. A little bit more with some of the other ones and some of the studies. Real life, it's been hard to replicate some of the weight loss numbers seen in some of the studies. Durability is pretty good, but people can gain a significant amount of weight back if they stop the medications. There can be GI symptoms like nausea, vomiting, rare cases of pancreatitis, but it is true. Like I saw another guy today. I've seen 2 people already this year who, were hospitalized with pancreatitis, but that is rare. It's not very common. Considerations. So these medications are losing real amounts of weight, and it's been really helping. There's some people out there that are just really benefiting from them. The downside is that they can be hard to find. They can be very expensive. If you don't have insurance coverage, even if you do have insurance coverage, sometimes the copay is, in the hundreds of dollars. If you pay for name brand semaglutide like Ozempic, it's about $1,300 a month. Mounjaro is about the same. And it can be hard to stay on these medications. There are compounding pharmacy versions of these that can be used, and we've found those to be successful too for some patients. You have to understand, what that all relationship is with compounding pharmacies, but it makes it more affordable and the access is much more consistent as far as like not being as many shortages. You're not having to like call around because there's literally no drugs around. I saw another guy today who was previously on Ozempic and just like can't find the drug anymore, even though his insurance covers it. It's nowhere to be found. So, and then there's a real big question about how much weight gain happens after these medications. I think some of that is program related, and that if you can manage, have a good plan, have a good program, get on a good schedule, get on a good structure, you can still see some success in maintaining weight loss. But there are definitely reports and published literature out there showing that it's really hard to maintain your weight after these drugs. Semaglutide, this is the base, the GLP-1, the most common one we see. Tirzepatide is the other one, so that's Mounjaro or Zepbound. So now we're going to move to the procedures. So the procedures part is the first one we're going to talk about is the endoscopic sleeve gastroplasty. So the ESG, or the endo sleeve. And this is a really cool procedure because what it does is that it uses a suturing device on the end of an endoscope. So it's really small and actually goes down through your mouth, and from the inside of your stomach. What we can do is take full thickness bites of your stomach and actually sculpt your stomach from the inside and make it smaller. using a pattern of and lots of sutures to crumple that down into a small size, which is super cool, really super cool. Weight loss is good. Really, it's very strong. 20 to 25% is what our average is in our practice. We're seeing good durability long-term wise, and complications are very rare, less than 0.5%. It's a really cool procedure. Downside, the considerations for that is that it's self-pay. It's not covered by insurance. Usually our practice, it's around $15,000 for all said. And that includes, all the aftercare, all the before care, the anesthesia covers. There's an insurance policy in there, and a bunch of other things that is included with that. The advantage of doing it with our practice is that we also do laparoscopic surgery and we also do bariatric surgery. And so if you need to transition to another surgery, we actually account that into if you need to self-pay, like for a sleeve, maybe later, if down the road, we have that as an option, and that we actually give you some credit from what you've already paid from a previous procedure. So call it the Adviva advantage. There's not as much long-term data. So by that, I mean 10-year plus, like we have with a gastric bypass, same. But truthfully, we have more long-term data with the ESG than we do with the GLP-1s, by a long shot. Data recovery rate's about 4 to 7 days. And usually you're back on your feet. You feel, kind of some nausea, some blah, for a few days. And then you're, oh yeah, I'm good to go. So if you have a procedure on a Wednesday, usually by the next week, you're back to work. No problem. So laparoscopic bariatric surgery. So this is the last one we'll talk about this topic. This is the gold standard of therapies for obesity. So that is done through small incisions. You can see here, you can see these little incisions. They're going to make poke holes, and then using a camera, which we watch a screen, kind of like doing a video game, we're able to do all the surgeries through these small, tiny, narrow instruments. The first operation we'll talk about is the gastric bypass. This operation has been around since the 60s. And so this operation, you take a small piece of gastric pouch here, you make a little pouch, and then you bring up the small intestine, you connect it there, and you bypass all this part with the green arrow in it. You're going to bypass that part of the small intestine. So not only can you not eat as much food at one time, but it's also not going to be as absorbed as well. The benefits of this is weight loss is very good. It's a really good procedure. We've been doing this for a long time. We know it works well. You have to take your vitamins with this operation. And it is a little bit, it's moving around the plumbing a little bit. So there can be issues with this long-term. Usually around the road of 4 to 5% of people have long-term, have an issue at some point in their life, But there's a reason this operation has stood the test of time, and that's because it's a very good operation, particularly for people that have diabetes or heartburn. So the last operation we're going to talk about, and the most common operation done in the United States and the world, is the laparoscopic sleeve gastrectomy. So your stomach, this big bag, is changed down to a small tube, and you remove all of this extra stomach here. It comes out. You don't actually put a sleeve. You don't put a foreign body around the stomach. It's not sleeved in any way. It's just sleeved as in you just remove the extra stuff. Truthfully, I believe, that the ESG is kind of a similar configuration to this, similar principle of making your stomach a lot smaller. The reason that works is that there's a lot of cells in the surface area of your stomach that are having a hormonal effect on your body's understanding of its weight, of understanding of its metabolism, of its blood sugar management, even blood pressure management to an extent. And when that surface area is reduced, it just dramatically changes and improves the hormonal layout of your body. So this has been a really cool tool. This is a fantastic tool. Its complication rate's very low. In our hands, it's less than 0.5%. But it works really nice. So downsides of these operations is that bariatric surgery is not always covered by everyone's insurance. About 50% of people in Washington have bariatric surgery coverage, but that means about 50% don't. And recovery is a little bit longer than, say, like an ESG. Usually about 10 to 14 days. But, a lot of my desk job people, they are back to work within a week of one of these operations. Seems that a bunch of people I did surgery on last week, almost all of them are back to work already. So the goal of these surgeries is to change your life, not to, get you back to work as soon as possible. But it's about using these tools really well. So we have a lot of visits in that follow-up year, and you get kind of sick of us. All right. So you're like, okay, I'm struggling with my weight. I know I need some help. What do I do? How do I take the next step? So reach out to our team, avivamd.com. You can go to our website. You can check out this QR code right there, and that'll take you right to this spot where you can reach out, and our team will get in touch with you, and let's get this journey going. So we have consultations are generally by telehealth. We can do everything by telehealth. If that's what you like, you can do it in person if you want. But telehealth is so convenient. It's a real game changer for being able to take care of your health, particularly from an obesity standpoint. Because if you're struggling with this or that, make a visit, go out to your car during your workday for 15, 30 minutes. We can do the visit. You can, take that really short break and get back to work without having to take tons of time off. And you can be really far away too. I have patients in multiple other continents. So we have patients all over Canada, patients all over the United States, some patients even in Africa and in Asia. So we have, they're from all over, and it's cool because telehealth is just, just got to factor in the time change. So review medical history and then make a plan customized for you. So that's how we start the journey. All right. Well, without further ado, thank you everyone for tuning in. Let's get on to the frequently asked questions. All right. So Erica asked, what are the prices? So the prices good question. So let's go through all these categories. Medications wise, most of the medications have some sort of formulary generic brand of the oral medications. So like Phentermine, Topamax, those medications are, been around for a long time. Excuse me. Their price is usually somewhere around the lines of like $20 to $40 a month. The GLP-1 medications are significantly more expensive. So at max dose, like compounded semaglutide is around $200 a month, or I think it's like $250 a month. Compounded tirzepatide is like $500 a month, or $450, about $500 to $600 a month. Name brand Ozempic or Wegovy or Zepbound is around $1,300 a month. So it's pretty expensive. Yeah. The endoscopic sleeve gastroplasty. So the expense of the ESG, the endoscopic sleeve gastroplasty, all come, like including anesthesia, insurance, follow-up, the first year, and the pre-op stuff, not including labs or workup things. That's covered by your insurance anyway. Is around $15,000. The laparoscopic bariatric surgeries are about $20,000, which is pretty competitive from a self-pay standpoint. I think of it like all of these things are generally cheaper than a bathroom remodel and will significantly improve your life more. The question always comes to, okay, so then which one should I do, right? Which one should I do? And also taking into account price, if you're really struggling with obesity, like BMI 30, 35, 40 plus, the best tool, the tool you will lose the most weight with and be able to keep it off the best, is the laparoscopic bariatric surgery. It's like a laparoscopic sleeve or a gastric bypass. This is hands down, no questions asked, the most weight loss that you'll experience on average and the most durable weight loss, like 30 years of data to say that. Yeah. The next best tool from a weight loss standpoint and from a durability standpoint is the endoscopic sleeve gastroplasty. We see generally more weight loss with an endoscopic sleeve gastroplasty on average than we do with, say, the other things like the other medications, including the GLP-1s. There is also the nice thing about a procedure is that you have the procedure and then there you go and you're off. And we have people years and years out. I've been doing ESGs for 4 years now, and we have patients years and years out that are still doing really well with their ESG. Which is great. So that's where I tell people, if you're not going to do bariatric surgery, do an ESG. If you're like, I don't think procedures are for me, I think that seems a little spicy. I just don't think I just think I'm there. Then you can think about a GLP-1 medication. So these medications, so say like Ozempic, Mounjaro, Wegovy, whatever. So these medications, they work really well. These are really good tools. And we have some people that are, significantly beating the national averages, which is great. And they're getting into these sort of numbers. I don't tell people that's the average, but it does happen. Sometimes they're like, hey, I want to roll that die. The downside is that, to the most extent, what we do know about these drugs, we have the least amount of long-term data on this. We have less long-term data than what you do even than the ESG. So it's important to remember that. And the data we do have shows that if you stop the medication, it can be a challenge to maintain it. In our practice, we really work hard to set you up for success long-term. And so we like to think that we do a little bit better from a long-term standpoint. And we have some patients that are doing well, but truthfully, no one's got a ton of time on these things already, at the doses that we're doing them. It's true that GLP-1s have been used for a long time, 10 plus years, but not in the doses, not at the high doses that we're giving them to people now to treat obesity. So it's a pretty different story. And what those higher doses of a hormonal medication will do to your body, we don't really know. And we know that any high dose hormonal medication there's other things that happen. There's other things that happen in your body. So actually from a cost effectiveness, so from a weight loss standpoint, from a durability standpoint, and also from a cost effectiveness standpoint, the GLP-1 medications are not as good as any of the procedures in their current form right now. So yeah. Medications, the oral medications are, these are good. We kind of say these are good adjuncts. These are good, like kind of decrease some food noise maybe in your head, help you, take some of the edge off of hunger or cravings or things like that. But, we don't expect this to carry a lot of water, when it comes to really losing meaningful amount of weight. So, all right, good question. Sorry, I kind of took that too. So yeah. And then Romelia, would like to know the price of the endoscopic sleeve gastroplasty. Okay, got that one. Yes, cool. So, all right. I think that's our questions for today, unless we have any other questions, Chris. So I'd love to, if you're out there and you're struggling and you're looking for, hey, what are my options? Just reach out. We'd love to help take care of you. We love taking care of people. Love to see just the numbers improve, but also more importantly, your life improve. There's so many other things that come with this journey that are really cool. And also, we've been doing this for a long time. We have a lot of experience, and actually are leaders in the field of really trying to make sure that we're one of the first people to have aftercare programs. We know the importance of that to set you up for success as well as we can. So I'd love to have you guys, reach out. We're here for you. And look forward to seeing you next time. Have a great day.